And so since you got diagnosed and now you shifted to Benaroya Institute and you're working on the type 1 research. So do you participate in the clinical trials or do you help others to participate in the clinical trials? That's what your job is there?
Yes, I'm still participating in the new onset study, and my main job is to help family members get screened. However, we also offer new onset studies for people who are just diagnosed, and so our goal is prevention and also preserving beta cell function.
Okay, preserving beta cell function. Okay. So, I mean, if your research shows that you're type 1 or you're going to become type 1, what kind of, treatment or what kind of message you give to the patient? Like, what should he watch out? What kind of things he needs to do to, push this away for a couple of years or something like that?
If family members are at risk and if they do decide to enter prevention study, one of the prevention studies we offer is oral insulin. Oral insulin is where the person at risk, they take a capsule of insulin every day, and the idea is to train the body to not see it as a foreign invader, and the goal is to prevent diabetes and delay diabetes, if that's the case.
Okay. So the only thing is you can only delay diabetes. There's nothing where you can reverse diabetes.
No, as of now, there's no way to reverse diabetes.
Because there are many, I see a lot of advertisements in the magazines or in news, like the big headings give like reverse diabetes or some false information that's floating around. So that's why I wanted to get clear on this stuff.
Yeah, unfortunately, no. But that's why the clinical trials are so important to get there, to get to a point where we can prevent and eventually cure diabetes.
Okay. So coming to the other part of your day-to-day type 1 diabetes, so how do you try to maintain the highs and lows, which are the most difficult part in managing diabetes?
Yeah. So again, like I said before, for me the motivation to do that is the instant gratification of feeling good. A lot of people worry, about complications down the road. They think longer about controlling their highs and lows, but for me it's really just the in the moment feeling good and feeling active and being able to go out and run and have my blood sugar in range to perform well. And my mind is clear. So I have my own tactics. Everyone's different, but just everything is balanced. I don't restrict so much to keep my numbers in range. You don't want diabetes to always be on your mind, to take over. You've got to live, and sometimes it's not going to be perfect, and you just have to be very gentle with yourself, very patient with yourself, and not get too hard on yourself if the numbers aren't where you want them to be, because it is so draining on yourself if you concentrate on those numbers so much. But do your best, and do your best for right now, to make you feel good right now, and that's what you feel good when you're in range.
Exactly. And are you using are you on insulin pump?
I am. Yeah, I've been on the insulin pump for close to 2 years. Okay. And I'm also using the continuous glucose monitor.
Okay. So what are some of the things that you learned from CGM, continuous glucose monitoring system?
When I first started the CGM, it was really tough. I reacted to the numbers very much, and every time I saw an arrow up or 2 arrows up, I would bolus, and would crash usually after that from a low. So I was frustrated with the CGM at first because it wasn't always completely accurate, and I reacted so much to it. It made diabetes so much more on my mind because I would just watch the screen, which is not good. So after a while, I learned to use the CGM and just a resource to mostly to see how my basals are. It's a really good test to see just my baseline. It's really good for exercise, to not go low, and to see those trends. And I've really taught myself to only look at the trends and not really the number. And it does help drastically to see what foods do what to your body, what causes really fast spikes and what doesn't, what's a prolonged increase. So it's just a really good tool to use just to get an idea of where you're at. And I know a lot of people who will wear it for 2 weeks and just to get a sense of what's going on with their body. And then they take it off. And I'm kind of like that. I don't wear it all the time, but just to get a baseline idea of what's doing what and what I need to tweak. And
that's good.
I feel very grateful to have that tool, to have that resource.
CGMS.
Yeah.
That's good. The other question is, what are some of the other resources that you think are helpful for type 1 diabetes patients that are coming from your Benaroyaresearch Institute?
Well, the resources directly through BRI, I think from getting involved in research, you get such great care from the coordinators and the researchers. Education, probably the best education you'll get from with your diabetes. But outside of BRI, I think that getting involved in the diabetes community, online diabetes community is important, as well as I know in Seattle there's really great groups who get together, and it's just a nice support system for people who live with it, and you can talk about it, and it's really great.
And if someone wants to get involved in your research, how do they approach you? How to approach you guys?
They can visit our website. They can contact me. They can see what they're eligible for. If they're in the Seattle area, even a simple blood donation is extremely valuable to us. If you're out of the area and if you want to get your family screened, you can still contact us and we'll get you set up at a center near you or send you a test kit. And actually, we are launching a new TrialNet website, TrialNet screening website next week. And it's specifically to give information on the screening process. And we have videos and a great quiz and FAQs. So it's one stop to get all the information on screening. And that's going to launch next week, and we're very excited about it. So and that is going to be trialnetpathwaytoprevention.org.
Okay, so I'll put the link down in the interview anyway.
Yes, please do.
Yeah, I will. So the other thing is you also kind of give more education on food, exercise, and also any other prevention tips from your institute?
No, we don't.
Or just screening.
Screening and intervention is from our diabetes program.
Oh, okay. So the other thing is, do you get involved? I see you involved in more of the social networks and all this stuff. So, so what did you learn from being on social networks, and also how helpful is it for you, being diabetic and also being on social networks?
Yeah, when I was first diagnosed, I got onto it for like 2 diabetes, and that was really helpful for me. And then when I started working here, we really wanted to expand, and we tried Twitter, and I really just wanted to listen to people and see what they had to say about their diabetes and their concerns, and it was really nice to get involved into the community online. and we wanted to be a resource also for people who use social media.
Uh-huh. So the other thing is, what are some of the things that you learned really hard way?
I think the hardest thing for me dealing with diabetes was I went through a time when I blamed myself so much. I blamed myself a lot for each number. It was just terrible. It was draining, and the more I did that, I realized just the more stress I was causing on myself and my body. And as soon as I let that go and really kind of relaxed and did my best to stay healthy, but realized that there are so many other factors that can contribute to a number, which is an assessment of how you're doing, that's when I really changed my diabetes management and how to go about taking care of myself.
So any tips for the or message to the diabetic community out there?
Balance. I think that everyone needs to balance the best they can, not only just with their numbers, but in their life. It's very important, and also on a bigger level to get involved in research if you can, because we're all in this together, and we all want a cure. So we gotta get together and do it.
And thank you so much for being on the show and passing this message to everyone.
Thank you.